we just talked about your artificial joint. What is that called? Reverse shoulder?
Yeah, it's reverse shoulder replacement.
Yes. And I mentioned that I have little different point of view about why it caused the bone loss. So your doctor saying it's infection, but infection has swelling, redness, heat. You feel hot, and then at least the white blood cell will go up. That's the bacterial infection. If it is virus infection, then you don't have the white blood cells go up. But they're saying you have bacterial infection causing that bone loss. And I think it's the inflammation, because whenever you have an artificial joint there, you tend to develop inflammation. It's a foreign material. It's going to stimulate your immune system. That's why I don't want you to stimulate your immune system with nuts and seeds, because it induces histamine with a spicy food, pepper, turmeric, and with alcohol, with the sweets. All of this induce the histamine, causing your blood vessel leaking. If your blood vessel leaking, then it can damage your soft tissue, your bone. So that's the inflammation. It could be here, it could be a joint, any kind of joint.
Well, I don't have any redness, but if I do put my hand on my shoulder, I do feel the heat, and I do have the pain, but the pain was minimal. It wasn't, it was something that I could live with rather than have surgery. And the x-rays that the doctor had taken as much as long ago as 2 years showed just a slight bone loss, and then the increase after a year, minimal bone loss. And it was only the slight pain that directed me to go and see him and have him take the x-ray, which found the bone loss. So if it had just continued at that level, I would not have agreed to surgery.
Yes, I think in any kind of cases, you gotta optimize the inflammation level, because inflammation is a process in which your body try to protect you. If you have a foreign things, like you have, if you have bacteria, virus, and then your body try to create inflammation to clear up, raise the temperature, increase the blood flow, so that the bacteria and virus cannot survive. And also the foreign material can be flushed away. But if this inflammation is too strong, too long, it's going to damage the tissue. That's related with like MS, ALS, rheumatoid arthritis, neuropathy. All of this process are related with inflammation.
Yeah, of the items that you mentioned, I don't drink, so I don't have beer or alcohol.
But you love sweets.
Well, my sweet level, because of my type 2 diabetes, you can check the level. It's not high.
But what's your
and yes,
A1C?
I am guilty of eating peanuts. I like peanuts.
So that's the one you get to throw it away. Otherwise,
okay, yeah.
If you're gonna eventually change this joint, you really have to keep the inflammation level down. Otherwise, you don't want to have the second joint, the third joint to change. You need to keep this joint at optimal level of inflammatory process, so you don't damage the tissue. Furthermore, when you change the joint the second time, you don't have to change the third time.
Okay, the other thing that happened is when the doctor had told me about the bone loss and what was going on, and eventually he would have to replace the shoulder joint. My primary care doctor took a blood culture, so he wanted to see if there was a bacterial infection in my body, and you looked at the results of the culture, and you didn't see a lot of indication
of the
that there was a bacterial infection.
Yes.
So that's leading you more so to say it's inflammation, and inflammation can cause slow bone loss. Why would I just lose the bone in this joint and not in other areas. Like this shoulder, I haven't had a replacement. I've had bone. Why don't I lose bone overall?
Because
like
you
all
don't.
of my
Yeah, because you constantly use this arm. The right arm you don't have pain, so you tend to use this more. Remember, after your first joint replacement, you play golf. You did play golf, and then you have the muscle pain, and then you stopped. So it's not like if you have inflammation, every single joint will be having pain. It's the joint that you use the most, because that joint has more wear and tear, and then the body will experience more pain.
Okay.
So control the inflammation is the way we control the pain. Thank you.
And replace peanuts with something else that I like.
Orange.
Yeah, okay.
All right. Thank you.
Thank you.